Good afternoon, and thank you for joining us for our Fort Benning Garrison Facebook Live Town Hall. I'm Ben Garrett, the Fort Benning Public Affairs Officer, and your moderator for our Town Hall. We look forward to an informative discussion focused on the questions you have provided us. Our discussion topics will focus primarily on the Fort Benning community, our permanently assigned soldiers, family members, and the Department of Army civilians and contractors who work to support the military assigned here, as well as our local community in Columbus and the Chattahoochee Valley region. So if you're a family member of a soldier in training, this forum may not be the right one for you because the topics discussed will focus on the Fort Benning community. We have several points of interest our panel will discuss, such as health protection condition, otherwise known as HPCON, DoDEA schools, and general orders, just to name a few. So let's introduce the panel. Joining us is Major General Patrick J. Donahoe, Commanding General of the Maneuver Center of Excellence in Fort Benning, Colonel Matthew Scalia, the Fort Benning Garrison Commander, and Dr. Lisa Coleman, the Fort Benning Community Superintendent for DoDEA. At this time, I'll turn it over to Major General Donahoe for some opening comments. Sir?
Hey, thanks, Ben. Hey, so I'm Major General Pat Donahoe. Been in command now at Fort Benning for about a little over 2 months. And so that whole time that I've been here in command, we've been at HPCON Charlie, and we were under General Order Number 5. And so I'm really excited about talking to you tonight because we've made great progress across the state of Georgia and across the Southeast in combating the virus. And really that's a testament to all of the folks associated with Fort Benning, all of the folks in our local area that have been abiding by all of the requirements to wear a mask, wash your hands, sanitize, keep your distance over the past couple of months. And we've seen a dramatic downturn over the past 6 weeks in the number of cases in the Columbus, greater Chattahoochee area. So that gives us this great opportunity now to move our health protection condition from Charlie to Bravo Plus. And so we've met the criteria, and we've been tracking a number of criteria to make that decision, right? The case rate, per 100,000 people in the area, our ability to treat those individuals who are sick, both on the installation and off. Right now, we track very closely the number of intensive care unit beds that are available both on the installation at Martin Army Hospital and those available in the local community. And then we have our own isolation and quarantine facility, which we call the Fort Benning Recovery Center here on Kelly Hill. And the capacity for us to house people there, we've been tracking. And right now, we're down to a very low number of folks in that facility. So we've made some great progress. So we're going to go to HPCON Bravo Plus. We're going to make that effective Saturday morning at 0001. So 1 minute past midnight, Friday to Saturday, we're going to go to HPCON Bravo Plus. It's actually allows us to reopen a number of our facilities on the installation. And Dr. Coleman will talk about the impact of the DoDEA and their ability to resume brick and mortar operations at a time after they've been able to properly prepare their facilities and their personnel to do that. It allows us to begin to return more of our workforce onto the installation, and so that'll be helpful. But it also allows us the flexibility to keep folks at home that need to telework because they may be high risk. It enables us to make those decisions to open facilities or close, depending on our ability to keep those safe. So the other piece of this does, it continues to do those things we require to keep COVID free, right? Still requires to mask when appropriate, still requires us to social distance, still requires us to proper hygiene. It's going to limit public access to the post, right? So we're not going to open a series of events on the installation of folks from around the area or around the country, right? So this still continues to maintain to our bubble. The other significant change is I signed our General Order Number 6 this morning. And that supersedes General Order Number 5, and it's effective immediately. So it's effective today. This does a number of things. Given the improvement in the conditions of the disease around the area, this allows us now to remove the travel radius for soldiers going on leave, pass, or TDY. And so we powered that back down to the chain of command to make those decisions, to counsel those soldiers on how to keep themselves COVID-free while they travel. But it really didn't make any sense anymore to say you're prohibited from going 100, 200 miles from the installation, where in reality, if you weren't protecting yourself right outside the gate, you were as vulnerable as somebody traveling to Davenport, Iowa. So we just put that back down to our commanders to properly counsel their soldiers as they go through their normal planning to take leave. And so the other piece this is going to do is going to return us to going to indoor dining downtown outside the gates of Fort Benning. We'd ask you to enjoy the local restaurant scene. It's a wonderful, vibrant culinary experience in Columbus and the Chattahoochee Valley. Love you to do that. We'd also ask you to just practice the normal precautions we'd want you to do. Wear your mask to your table. Take your mask off while you're drinking and eating. And then, of course, if you're at the restaurant and you stopped eating, but you're still there 3 hours later and you're on your 17th beer, you're probably not in a restaurant anymore. You've now transitioned into a bar. Bars remain off limits. And so we'd ask you to act within the spirit of the general order. Right. So we're opening up off-post gyms. And so, again, we'd ask you, and again, restaurants and gyms that are going to be back on limits are those that are practicing the proper conditions to keep folks safe as we go through this transition. Okay, so what hasn't changed in General Order Number 6, right? It applies to everyone who has access to Fort Benning. So again, your access to Fort Benning, whether you're a soldier, a civilian, a contractor, a family member, is contingent upon you following these rules, and we really truly appreciate you doing that. Right. So again, bars are off limits. We're going to limit the size of indoor ceremonies to 25 people. We're going to give exceptions to policy to colonels so that they can manage if they're in an extremely large room and they want to bring in more than 25 and they can maintain the social distancing, they can do that. But again, indoor ceremonies, indoor events, kind of limited to 25 people. Again, we're still asking you to wear your mask. We're asking you to conduct personal hygiene. We're asking you to be socially distanced, whether you're on post or whether you're off post, whether you're on duty or whether you're off duty, no matter who you are on the installation, right? We're going to continue to require masks at our facilities on the installation, right? So if you go to the commissary, we want you in a mask. If you go to the PX, we want you in a mask. If you go into our buildings on the installation, we want you to be masked, right? And so again, I think these are prudent measures to keep us COVID-free, and it allows us to make our decisions based on the disease. And we've seen a steady downward momentum and trend of the disease. That's great. So we can open things up, but I'd ask you to practice those things we know we're gonna be able to react to. Okay, and again, as you know, the decision we're making today to go to HP Com Bravo Plus and to go to General Order Number 6, it's based on the disease and the progress we've made against the disease. If 2 weeks from now, 3 weeks from now, we have a significant uptick, we've all got to be prepared to snap back to HP Con Charlie. We got to be prepared to snap back to more restrictive measures that were, part and parcel to General Order Number 5. But again, really excited to talk to you tonight, answer your questions about the trajectory we're on and the good news that we're able to share with you tonight. And so really look forward to the discussion. Thanks, Ben.
Sir, thank you. Colonel Scalia, your opening comments, sir?
Yes, thanks, Ben. Hello, everybody. I'm Colonel Matt Scalia, your Garrison commander. And much like the commanding general said, very happy to participate in this and share good news with you. I want to talk some specifics, though, what it'll look like, the Garrison services here on Fort Benning as we move to HPCon Bravo and under General Order Number 6. You know, really little difference in the services we're providing because we've opened up just about everything. It's more about how we are providing them. Okay, so for example, restaurants, we've been able to provide dine-in service here on the installation for some time now because we've been able to control these mitigation measures. So that remains the same. Mitigation measures including the social distancing and limited seating within restaurants. Our gyms, you will still see mitigation measures within the gyms, although we have recently reopened them to weekend hours and the morning hours, which had been exclusively for soldiers, are now open to all ID card holders. The theater, movie theater, is a great thing we have here in Fort Benning, and we are working towards opening that as well. But you'll have to make sure that the right mitigations are in place. So no date set yet, but confident we can achieve that. Larger groups will allow for larger attendance to some of our training for our soldiers and staff. So we will look at other venues as we increase the number to 25 people. So that's a good news story for a lot of the mandatory training that we provide in our Garrison services. With respect to those living on the installation, you really will not see a difference in the Villages of Benning maintenance program. Okay, they will contact you and ask the questions, make sure you're not at home with any quarantine or isolated personnel. Please do not forget your responsibility to contact the Garrison Housing Office if you do have somebody in your household who is in that restriction of movement. So we don't have maintenance personnel coming to your home for work. And most importantly, though, I think and most beneficial to many of you will be our child services, able to expand them under HPCon Bravo. So if you are on the wait list for our CDCs or school-age services, you can expect a call tomorrow from Child Youth Services informing you that you have a space, okay? Not everybody. Okay, we're expanding the spaces total across the board in all those services by about 60 to 70, so that'll help out many of you, but we can't go back to full capacity until conditions continue to improve and we can drop back down to HPCon Alpha. Installation access will remain the same. Okay, we will keep the Trusted Traveler program suspended, so every occupant in the vehicle must show identification, although we are still allowing visitors of residents on post. For those of you who work here in Fort Benning and are currently in telework status, your supervisors will be getting in touch with you to develop a plan for you coming back to work. If you have concerns about the work conditions, especially if you have health concerns, that's a discussion with you and your supervisor where you might be able to pursue and request reasonable accommodation. Supervisors, please work with them, and if either supervisors or employees have questions, please don't hesitate to contact the EEO office. So a lot of people might have questions about Halloween. I'll just say right now, we are hoping to set the right conditions and provide the right restrictions and measures to have as close to normal Halloween as possible. Units do have the ability to conduct their separate events, okay, of course, under all appropriate mitigation measures. So we'll be providing more information on Halloween in the coming weeks. Lastly, direct everybody's attention to the two great forums for information. One is here on the Facebook page, the COVID-19 forum specifically on the Garrison Facebook page, but also the web address, our website, which has a specific COVID-19 information page as well, where you can get the latest on installation access, on services that are open, as well as answers to the frequently asked questions. Thank you very much. Ben.
Sir, thank you very much. And Dr. Coleman, please.
Good afternoon, everyone. My name is Dr. Lisa Brooks Coleman, and I am the Georgia-Alabama Community Superintendent. And so it's truly a pleasure for me to be here with you this evening to recognize and be excited about us moving to HPCon Bravo Plus. What that means for all of those who are listening and who have students who participate in our DoDEA schools is that for those students that are enrolled in remote instruction, they will be allowed to return to in-person instruction. And so within 2 weeks of this decision, you will be receiving communication from our school principals relative to information of turning in computers and being ready for the next step and having our students ready for our in-person instruction. For those students that are currently registered for the virtual school, your learning platform will not change. Please realize that we are continuing to provide instruction to all of our students, be they in remote or in virtual learning, and it is an exciting opportunity for us to be able to get back in our schools. Throughout the process, we have been preparing for this day, and so we have retrofitted some of our schools with plexiglass and other safety measures, but we have multiple stations for hand sanitizer and also other sanitizing devices throughout the schools. So that being the case, we are excited about moving to HPCon Bravo Plus, and so we look forward to an in-person instruction. Thank you.
Dr. Coleman, thank you very much. At this time, we'll move into our question and answer session. We have several questions that the audience have submitted to us, and we're happy to address those at this time. Our first question, Dr. Coleman, what is Garrison and DoDEA plan for those children with special needs who require in-school services?
So as we move to in-person services, the plan would be to definitely support those students based on their specifically identified needs. So within 14 days of this announcement, those students will be back in in-person learning for those that are in remote learning. For those that are in virtual learning or in virtual school, they will still continue to get the support not only from the virtual school, but there are also some supports embedded from the brick and mortar school as well. So we're going to move out and providing those supports for our students.
Great, thank you very much. Our next question, I think this will be to you also, Dr. Coleman. What is your plan or your timeline for children to enter back in school, especially special needs children who are regressing each day? What does your 60-day plan look like for putting children back in school? What is your 60-day plan for special needs children who require services that virtual learning cannot achieve?
So our 60-day plan is actually it's a 14-day plan. Within 14 days, those students will be back in school and be provided in-person instruction. And so that's something that will happen very, very quickly. And we'll assess those needs of the students and continue to provide them support, as we'll coordinate the support through our various resources. Lots of communication through the case study committees, the IEP teams, and the staff that are at the school, in addition with the leadership at the school and the leadership at the virtual school. This is a partnership with us. Those students that are enrolled in the virtual school are still our students, and so we still have a connected process in relationship to providing their support. So we don't have a 60-day plan, we have a 14-day plan, and after those students return to the in-person instruction, off of those that are in virtual, we'll continue to work that plan and provide them support. So much less than 60 days. If anyone should have any questions, any specific questions about specific needs of their student, again, I'd encourage them to first begin with the school principal and then also reach out to our instructional system specialist for special education, Dr. Tammy Person, and her office is located here at Fort Benning.
Okay, great. Thank you, ma'am. Our next question. Sir, I think we'll let you take a stab at this one first. What would conditions look like if Garrison will change to HBCon, Health Protection Condition Bravo? Sir?
Yeah, thanks, Ben. Hey, So again, at 0001 Saturday morning, so minute after midnight between Friday and Saturday, we're going to go to HPCon Bravo Plus. And so what that means is it allows us to have greater freedom of movement, right? So changes our leave policy and the restrictions on mileage for leave. It allows us to grant folks the ability to go and eat at indoor restaurants and go to downtown gyms. It allows us to open more facilities, both off and on the installation, increase our hours, allows us to expand out the number of personnel that can come to certain events, especially our indoor ones, allows us to have bigger outdoor events and ceremonies. And so, the movement from HPCon Charlie to HPCon Bravo Plus allows us to lessen the restrictions that we had in order to keep ourselves, virus free in an environment that was pretty significant with the virus 2 months ago. We've now come away from those conditions, been measuring them very closely, and we'll move to HPCon Bravo Plus to do that. And just so you're tracking, we're doing that in parallel with the major Army posts in the region. So, I talk almost daily with Major General Hersey and Major General Agudo at Fort Gordon's and Fort Stewart. They're on a trajectory along with us. We're not actually going to Bravo on the same days, but we're all talking about moving in that direction. So very, very concerted effort. I'm talking with Major General Francis at Fort Rucker in Alabama. They went to HPCon Bravo last week, and so again, we're all looking at the same data. We're all looking at the unique issues we have in our local areas. But as we've seen the southeast of the United States make significant progress, all 4 major installations in Georgia and Alabama are heading that way. Thanks.
Okay, sir. Great. Thank you. Our next question, I think it ties into HPCon Bravo and maybe a few more details. I know you addressed it during your opening comments, but a lot of questions and a lot of people about restaurants, eating in restaurants downtown and other locations. When are we allowed to eat inside restaurants again, sir?
Okay, so that is a condition that's covered by the general order, and I signed that this morning. So I know it's at dinner time, but if you haven't eaten yet, you can go downtown and go to a restaurant tonight. Okay. Again, what we'd ask you to do is just use common sense, ensure you're wearing a mask, sanitize, go to restaurants that are practicing mitigating measures, right? So if the restaurant of your choice, everybody's packed in, shoulder to shoulder, that's not the place you want to be. We want you in places that are taking the appropriate measures to protect their clientele. But we also want you to be able to go downtown and enjoy the great culinary scene here in the Chattahoochee Valley. So go out tonight, have dinner. Don't find yourself in a bar because those are still off limits.
Sure, great. That is fantastic news. I know everyone's welcoming that. Our next question, we have received numerous questions, quite a concern and long anticipated. Some information with this question. When will the NIM, or the Benning Road Gate, return to its normal hours of operation? I know it's recently open in the mornings, but this question addresses the normal operations of the Benning Road Gate next to NIM. Colonel Scalia, sir?
Yeah, thanks, Ben. So everybody, good news on that, right? So as Ben just said, we did reopen it for the morning hours for the past couple weeks from 6 to 9. This coming Monday, as we anticipate more people coming in for work, we will reopen the NIM gate. Back to normal hours of 6 in the morning, 6 in the evening, and that includes the weekends. Yeah, it's important for everybody to understand the backstory to this. Before we closed the gate, we closed the gate initially because of reconstruction efforts to it. So when you drive back on through Benning Road now to the gate, you'll see a much wider, repaved, much nicer road. And then COVID conditions hit, and we decided to keep the gate closed because we had a smaller population coming in to Fort Benning, and quite frankly, because it saved us manpower. Please understand, in order for us to keep that gate running, it relies on soldiers to help man it. And those are soldiers who are having to pull away from their normal duties and responsibilities. Okay, but it is higher demand now as we move to HPCon Bravo and more people come into work. So starting Monday, we will reopen Benning Road Gate. Thanks, Ben.
That's great news. I know it's welcome news as well. Sir, our next question, I think we'll have you address it as well. It has to deal with the commissary. Would it be possible to address the commissary's current policy on personal grocery bags? In light of the mode of transportation for COVID-19 and the infectious dose, the ban on personal grocery bags is not helpful in the prevention of spread. In addition, all those extra plastic bags are harmful in the way of waste production. Thank you for your time and looking into this situation. Sir?
All right, Ben. So we did look into the situation. Right now, DECA, the commissary's managing organization, is keeping to you may use your own recyclable bags. You may bring them in, but our baggers will not be able to bag in them. So you bring them, but then you're going to have to bag them yourselves. We'll continue to engage them on this and see if they might come off it. But certainly while we're in HPCon Bravo, that is the standard that they are maintaining.
Okay, sir, thank you very much.
Can I comment on that?
Absolutely, sir, please.
So that's actually a pretty good win, right? So, we've been getting ICE complaints. We get some inputs from other folks around the installation asking for the capability to bring their own bags in. And so we've now been able to negotiate through Colonel Scalia and his team with DECA, and now we've got an agreement to be able to bring our own reusable bags in. And I think, because I use reusable bags, the majority of people do that so they can go in and pack their own bags anyway. And so I know most people do that just because they care about their groceries. I do that to save on the tip. Thanks.
Sure, thank you. Thank you very much. So our next question. What is the realistic time frame that children will be back in person learning when HPCon Bravo is established? Health Protection Condition Bravo is established. What is the detailed plan for reopening the schools? Dr. Coleman, would you take that, please?
So our detailed plan, I'd be glad to take that question. Our detailed plan includes 14 school days from the day of the announcement. We'll be back in school. And so what will happen while we're preparing to open school, you're going to receive lots of communication from the principals of each of the schools providing specific information on how to access the school to ensure that all of the components of the school are very readily available for our students. So you're going to receive information, one from me, indicating when that specific day is that school will be open. And then two, from that point forward, you'll receive several pieces of information specific to the school from the school principal in relationship to how your child will access the school, what are the conditions they will need to have, what are the components they'll need to have, what tools they'll need to bring with them. But I can readily say to you, they'll need to have a mask. We already know that that is a component that we are expecting that all students have, not only as they enter the school building, but also as they ride the bus. So you'll receive lots of information in relationship, very detailed and very specific.
Sir, you have some comments? Please.
Ben, thank you. I'd like to add on top of that a bit. So, listen, many of us already have our kids in schools outside the gates, so we see how different schools have their own mitigation measures in place. Please know that Garrison leadership working so closely with DoDEA leadership on what it looks like. So we've walked their schools, we've walked schools off post, we've walked through our own child development centers, and always with medical teams to see, what more we can do to mitigate risk. Everybody should feel very comfortable about their children going in school and the measures in place, the safety, and should something happen, the right process to prevent a spread, to get the information out, and to prevent further spread. So I feel very comfortable about the way ahead with DoDEA. Thanks, man.
Sure, please.
Yeah, and just to reinforce, I've got skin in the game. My youngest is in a DoDEA school here on the installation, and she'll return to brick and mortar schooling when DoDEA opens. And so I've got absolute confidence and trust in the professionals running our schools here that we're going to do this right, and our students will be safe going back to school. And so I really look forward to that. So I appreciate DoDEA's work on that and Garrison's cooperation. So thank you.
Okay, sir. Thank you very much. Great information. We've gotten a lot of questions about that, and so I know everyone's very thankful to hear those comments. So our next question. The CDC guidelines have said that the children need to be in school in person, not just for their education, but also their mental well-being. There are guidelines that also assist with keeping things safely running in schools and assistance offered by the CDC. Do you plan on using these guidelines? Dr. Coleman, would you start off with us?
Will
With that one,
definitely.
please.
So DoDEA has operational guidelines, and those operational guidelines are actually a combination of the CDC guidelines and the Department of Defense guidelines. So we have already started to implement those guidelines, and we've put them in place. We're continually reviewing the information as it becomes available, and as that is the case, we're updating our information and updating the steps that we take in order to ensure that that is a safe and equitable process for all students and all staff. It's very important to us that our staff and our students are safe and feel that this is a safe environment, and actually we've set up a safe environment for them. We recognize the challenges that have occurred in relationship to COVID-19, and we've taken extra steps to ensure that we have aligned our practices to those processes. Thank you.
Okay, ma'am. Thank you very much. That's a great comment. Sir, our next question. Holiday block leave. Will soldiers in training classes be allowed block leave? For example, my husband will be going to Ranger School November 1st. So normally he would get a holiday block leave in December, but because of COVID, I know things are different. I feel as if anyone in a training like that should be able to have a holiday block leave, even if they are restricted to an area. These soldiers have families and young children that don't want to miss out on holidays because of COVID. Sir?
Yeah, Ben, first off, thanks for the question. The holiday block leave is a go. I say it again, holiday block leave is a go. It's important for that Ranger student to go out and get a Ranger burger. That's important. It's more important, to be honest, for our drill sergeants to get a break from the really onerous work they've been doing in the COVID environment, where they're getting less time between pickups, and they've, those men and women are a great deal of stress. And so General Funk, the training and doctrine commander, commanding general, has guaranteed us that we will have holiday block leave. Now we're still working through the plan of that. The day it will start, the day we'll need folks to return. There may very well be significant measures that we take on the far side of holiday block leave to ensure that we haven't brought a good number of folks back with COVID. So we're going to have some controls in January that probably will be a little bit more stringent than we have now, that we've just moved to now. But we're working through that staff process. But for everybody out there, if you're planning holiday block leave, put your leave form in through your chain of command. If you're a parent of one of our students or soldiers in training, you can anticipate that soldier being authorized block leave for the holiday. Right? There will be some challenges, right? We will have some of those soldiers will probably have contracted COVID. Some of those soldiers may well have been in a contract trace. Therefore, we're going to do the right thing. We're going to ensure that those soldiers are isolated or quarantined. That if that takes them through the holiday block leave period, that'll be undesired. But we'll make those individual choices when we have to. And then there will be some folks that there may be if a soldier wants to go overseas for holiday block leave, we're still waiting on guidance from our higher headquarters on if that will be permissible. And so we're working through all that. But generally, you can guarantee for the vast majority of our soldiers, both our permanent party and our trainees, that they will be granted holiday block leave. And so and I personally am looking forward to that as well. So thanks.
Sure. Thank you very much. A lot of questions about holiday block leave. Sir, I think this next question will have you address first. Is it possible to move the HPCon, the Health Protection Condition, to Bravo and still not have Family Day or open graduations for basic training? since those people come from all over the country. It's not just our kids with special disabilities that are struggling with virtual schooling. I'm not sure how both those are tied, but I think it deals with HPCon Bravo versus Bravo Plus and opening up the gates to more and more people. So I think they were trying to get after family days and bringing in that vector of more and more people here. Sir?
Yeah, Ben, thanks. So the plus portion of health protection condition Bravo is getting after exactly that. We're going to still limit access to large populations coming on the installation. We are not going to open graduations just yet for basic training. We're not going to have on-post family days just yet. We're going to continue to watch the progress of this disease. We're making a significant change right now. We've got to see the impact of that on the disease, and therefore, that'll be a further discussion as we watch the progress or regression of the disease over time. But right now, HPCon Bravo Plus for us is not going to permit family days in person, and it's not going to permit public graduations. Thanks.
Okay, sir. Thank you. There were several people concerned about those big crowds coming back and what that might bring, and I know that taking it slow and fighting the disease. Sir, our next question, I think Colonel Scalia or General Donahoe, I think both of you may have some comments on it. Will retirement ceremonies be held anytime soon? Sure.
Yeah, I'll take that, Ben.
Okay.
Yeah, we've actually already started retirement ceremonies. We're limiting the audience, but we're doing retirement ceremonies in person on the installation. And so, but again, it's a smaller audience allowed in the Marshall Auditorium for the ceremony itself. We're still streaming the ceremony so you can watch it and family can watch it. We're going to be able to expand the number of folks we let into that ceremony now as we've moved to HPCon Bravo Plus and to the General Order Number 6. But it's still be a limited audience based on the fact that we still have COVID in the environment, right? So nobody should walk away from this saying, it's back to normal. It's not. It's a small step to open facilities and activities, right? Given where we are with the disease. So we're doing retirement ceremonies in person. They're just a smaller audience than they were 9 months ago. Thanks.
Okay, sir. Thank you very much. Our next question, sir, we've done a lot of town halls. We've always talked about the commissary, visitors, and definitely the ID card section. And we had a participant ask, please get a better system in place for DEERS. We have children doing virtual learning at home, and now we can't get appointments and have to wait hours in the morning. We are told if a drill brings in a private with a CAC card issue, we are pushed out of line. We come early before and here, and it's due to this that our kids are missing out on learning. I think they're concerned about being bumped and the impact that has on the virtual learning. Sir, if you have some comments, please.
Yeah, sure, Ben. So there's a lot to that, and I appreciate that question because it certainly can be a headache. I mean, even under the best of conditions, nobody enjoys going and getting a new ID card. First, let me inform everybody, if you haven't gotten the word already, that the Undersecretary of Defense has approved an extension of the Uniformed Services ID cards, those expiring from this past January 1st, 2020 through 30 June 2021. Okay, so this means as long as the cardholder's affiliation is unchanged, these cards, which expired in that period, are authorized for continued benefit use until and through June 30th, 2021, to include accessing military installations, PX, commissary privileges, and as well as your medical benefits. Now, that doesn't mean you need to wait and you want to wait until that late. So, some time ago we did reopen ID card services. So we've wanted to relieve some of the pressure from the main ID card services location and DEERS location and open a second one strictly for CAC holders, okay? These, your soldiers and DA civilians who need the CAC cards. They are going to different and separate location. For the ID card office over by the commissary, we maintain walk-in service between 7:30 in the morning and 11:30. Okay, sometimes you might get bumped if there's a priority that comes in. However, I need to make sure that my office there understands if it is a uniformed member, they need to go elsewhere. So those of you waiting in line are not bumped as frequently. And then you can still make appointments, though, in the afternoon. All right. So again, I direct you to the Fort Benning website. It has a separate COVID page. It has a separate ID card tab to it for the latest information. I appreciate your patience. I'm sorry for the inconvenience. We're trying to sort through and finding the best system for you all. Thank you.
Sir, thank you.
Yeah, can I comment on that?
Yes, sir. Absolutely. If you have, please.
Hey, so I hope what you heard from Colonel Scalia is if you've got an expired ID card out there, you don't need to come back in and get a new one. Both of my kids, their ID cards are currently expired. And so we've listened to what the Secretary of Defense has allowed us to do, and we've not had any issues coming on, off the installation, going to the PX, going to the commissary. Right, so I think the Garrison staff has educated all of our workers on that kind of exception. That hey, we understand what's happened during COVID, and if you don't have a valid ID card just because it expired, hey, it's still good. So again, my two kids, whether I want to or not, can come on and off the installation. And so I think what would be really helpful is if anybody out there is finding where they're actually being challenged by the medical community or the Garrison, the commissary, something because they've got an expired ID. That would be good to know because that's an education training issue for us to get back and ensure that our folks know the current state. But again, if you got an expired ID card, you're good. You don't need to come in and get online or in the Deers facility. Put your kid into virtual schooling for 14 more days and then get them in brick and mortar and with their expired ID card. Thanks.
Sure. Thank you very much. Okay. Our next question, Dr. Coleman, I think it's a question that you may address. Can there be any kind of consideration for kids with the IEP and figuring out how to get them back into school before the other kids? If it's a number, that's a concern. Regression is the biggest concern for this reason, and also the services kids receive in school isn't practical for kids online. Ma'am?
I think that question probably was submitted prior to General Donahoe's announcement going to HPCon Bravo Plus. So as those students are eligible to come back into the building, we're going to definitely provide those services. What we want parents to really know is that we are aware of the concerns of regression. We're aware of the concerns relative to the virtual learning and remote learning that, of course, we would rather have had in-person learning. But based on the coronavirus, we needed to do what we were supposed to do in order to ensure our students and staff are safe. So upon coming back into the brick and mortar schools, we're going to take adjustments for that or make adjustments for that. We're going to be very patient in relationship to providing those supports for all students, whether they are in remote instruction or if they're in the virtual school. We're very well aware that this has been a challenging time, and we do appreciate everybody's patience in relationship to this.
Ma'am, thank you very much. I think the next question we'll address, we'll turn to you for some information. How do you plan to address burnout regression from online schooling? Are you tackling the success of the CDC full-day pre-K program that has been face-to-face for a month? How do we explain to our children why their sibling gets to go in-person class while they have to remain at home? Ma'am?
So there again, I believe that question was probably submitted previously before the General's announcement. We're going to, again, be very well aware that students have had opportunities to improve their instruction. We have had some students thrive in the virtual remote setting, and we have also had some students that have experienced some regression. As that being the case, we're going to work with all of those students to ensure that they move forward. Our teachers have been working diligently, looking at standards and looking at methods in order to improve student acquisition of standards and curriculum as they've worked tirelessly throughout this process. So please know that the heart of education is to provide that instruction, and we have that focus for our students, and we will continue to work with all students ensuring that they are receiving what they need. We just ask that everybody be patient as we start to transition back into the building to give us an opportunity to make those adjustments as needed.
Ben, I need to tackle the second half of that question with respect to the Georgia Pre-K. So Georgia Pre-K is not DoDEA program. It is a Georgia program, though run in our CDCs here on post, Garrison CDCs. So, just as we saw different counties off post have, different school plans, it's the same on post. Okay, so the state of Georgia made the decision that they were going to execute their Georgia Pre-K program. They were going to conduct it. So, and as we have three CDCs that run that program, we were able to get the right measures in place with our medical staff, with the CDC staff, and the Georgia Pre-K instructors to be able to do that. So, as far as the challenge of explaining to your children, I think we can all appreciate how difficult that can be. But suffice to say, they are two very separate programs with different decisions being made on when and how to conduct instruction.
Okay, sir, thank you very much. Our next question, I'd like to, let's see. We're all concerned about COVID right now, but we're entering another season. Colonel Scalia, a question came in about flu shots. Does this installation have a plan in place for this upcoming flu season? How is Fort Benning planning to handle the flu, COVID at the same time this fall and winter, since they have such similar symptoms? Are you planning to treat the flu in the same manner as COVID, which would continue to force our children to remote learn? The season, if someone is believed to have the flu but not also be viewed as COVID, are they going to have to get tested for both the flu and COVID, which would automatically put people into another quarantine? Once there's a COVID vaccine available, are you going to mandate such a new and uncertain vaccine for our kids and military members? There's a lot into that, sir.
Yeah, Ben, there's a lot to that. I'll try to work from the top, or rather from the bottom up. We're not mandating everybody get the new vaccine. I think we all are aware it's not even out yet. It'll take some time, trial, and who knows even what will be available to us. Okay, with respect to the challenges of the symptoms being the same, unfortunately, because of that reason, we're going to have to work off an abundance of caution as we have through this entire pandemic. So, all the more reason it is important that everybody gets their flu shot. So, you get the flu shot and you come down with the symptoms. Perhaps it's more likely, or we can deduce that. These are probably because of COVID, so then let's go into quarantine, remove yourself from work or from school to protect the others. Okay, it is very challenging. We've all the entire country is facing the same challenge and asking these same questions. But again, we're just going to have to work off an abundance of caution on that. For the flu vaccine, Martin Army Community Hospital has been providing the vaccine for the past week. They do have some more dates coming up, specifically 28th September to 2 October. At the Pediatric Respiratory Urgent Care Clinic. That's building 3216. So, please, get your vaccine yourself. Get your children your vaccine, especially if they're in school with other children. I direct your attention to Martin Army Community Hospital website and its Facebook page. Thank you.
Sir, please.
Yeah, Ben, I'd just like to comment on that because. Again, we're asking everybody out there the same thing we've been asking now for 6-7 months as we've gone through COVID. If you feel sickly, leave quickly, right? If you've got symptoms, stay at home. I think that's the worst thing that could happen during the flu season would be to, hey, I don't feel well. It's just the flu. And therefore I go into work, expose everybody, and then all of a sudden 2 days later you get tested positive for COVID, right? So you've got to treat any symptoms as if they could possibly be COVID. And so we'll work through the protocols with the hospital on what we can test and what can get us to, a better idea of what we're dealing with when flu season truly comes. But as Colonel Scalia said, the best remedy here is go out and get the flu shot. But then also, when you've got children and you're going to send children to school, if you think they've got the flu, don't mask their symptoms with the over-the-counter medication of the day. Right? You've got to treat that as it possibly could be COVID. And so we've got to all make those important decisions every day about ensuring we're not inadvertently exposing greater populations. And so again, this flu season will be a little different because it's going to run in parallel with COVID, and so we've got to make decisions to protect the force and protect our family members and our students and our teachers, right? So I'd ask you to, with an abundance of caution, if you've got any symptoms, you're treating it as if it could be COVID. The other piece on the vaccine, as Colonel Scalia said, the vaccine's not here yet. Therefore, we don't have rules, right? So the comment mentioned about soldiers, right? Soldiers get told to take vaccines all the time, right? I was a pincushion for my first couple of years in the Army, and so we'll deal with that and the implementing instructions that come out. When and hopefully soon we'll get a vaccine, because that's really the best way out of this problem set we've got. So thanks.
Okay, sir. Thank you very much. We only have time for a couple more questions. Our next question, sir, I think we'll direct it your way. Why are soldiers traveling from across the country to attend schools, not including basic training here at Benning, and not having to quarantine as soon as they get here? I work on base. I come in contact with them daily. They are free to shop, get food, ride share, and only start the quarantine process when their school starts. But by that time, they could have possibly spread COVID in many places. Sir?
Yeah. First off, that's a great question. So depending on the school those soldiers are coming in to go to, there are different rules for them coming here. So as an example, if a soldier is coming in to go to airborne school, the rules are right now that before they depart their previous installation, that they do a restriction of movement for 14 days. And then they travel here with an exception signed by a general officer. They travel here on sterile transportation, so that's a bus that's been contracted by the Army to send them here. They come door to door, basically. Or they're driving in their own POV, and we've given them specific instructions of what they can do along the route. And so that's a significant control mechanism that we don't normally have. But I'd also tell you, in the fact that we've just issued General Order Number 6 this morning, our soldiers here on the installation will travel around the country, and they will go to different schools. They will go temporary duty. They will go on leave. And they will come back. What we're asking everyone to do is to protect themselves as best they can as they move around the country, whether it's on leave or going to school. And I think that is the best thing we can do. Right? We have a number of schools where we test upon arrival at the school, but we have some schools that we do not test as they come in. It is those individual choices to follow the protocols that we know are pretty effective in keeping you COVID free, right? And so that's what we'd ask you to do. Thanks.
Okay, sir, great. Thank you very much. Our last question. Colonel Scalia, the question is, I'm a spouse and living on post, and I would like to volunteer to work at the polls on November the 3rd. Is this something I'm allowed to do per General Order Number 5?
Is this an election year? I wasn't aware.
We're tracking that.
So, of course, and certainly under General Order Number 6, you can now. So, just as long as you maintain those mitigation measures, you're wearing your mask, you're keeping away from people as much as you can, trying to stay distant. Should you be at a table, do you have the right protective equipment? I'd ask to work with the election commission. Will they have? I suspect they will have screens there to protect you as well. So as long as you're implementing all those protection measures as a standard, and we've come to know and love for the past 6 months, that's absolutely, and I'd say not just acceptable, but encouraged activity. Thank you for looking to support your community with that. Thanks, Ben.
Sure, great. Thank you very much. And so, the panel audience, that concludes most of our questions tonight. We definitely appreciate you submitting those for review and to get the information that you requested. Sir, at this time, do you have any closing comments?
Yeah, I'd put it out to the other panel members if you want anything to say in closing. Dr. Coleman?
I would love an opportunity. I just want to thank everyone for the opportunity to participate in the town hall. I'd also like to take an opportunity to thank all of the teachers who've been working so very diligently throughout this process in ensuring that their students are receiving their instruction. I'd like to thank the administrators, and definitely I'd like to thank the soldiers and those little soldiers that we definitely work with day in and day out. We appreciate your support. We appreciate your patience. We do understand this has been a trying time, and we look for your continued connection with us through our school principals and also through my office. Thank you so very much for what you do and the opportunity to serve.
I will echo much of that. Thank you to Dr. Coleman, her team, DoDEA, and those great teachers out there as they're trying their best. It's certainly a very challenging situation for them as well as for all our children, our families and students. I'd ask everybody to understand, going to HPCon Bravo is not like flipping on a switch and things are just going to go back closer to normal. There is a lot of preparation required, hence the 2 weeks for DoDEA to get things moving and started and prepared for our students, and much the same for Garrison activities. We'll have to work towards changing some of these, getting the conditions right to meet HPCon Bravo. If you do have questions, please, again, I'll reiterate our website, which has a specific COVID page to it, and the Fort Benning Garrison Facebook page with its separate COVID-19 forum. You can get a lot of your questions answered there, but we're always open to suggestions and follow-on questions. Thanks, Ben.
Sure, thank you. Sir?
Yeah. Again, thanks first off for tuning in tonight. I know there's a lot of interest in the topics we covered tonight. I know there's a lot of angst out there given COVID. There's a lot of concern that kids can't be in school. There's a lot of concern of now kids going back to school. And so what I'd ask you all to do is just be kind to one another, especially on social media. Right, as we work through these processes, be respectful of one another as we work through the challenges associated with the pandemic and our response as a nation to it. Right, so it's okay. Just want to cover, just kind of recap a little bit. So I signed General Order Number 6 this morning. It's out on our social media pages. It's out on our websites, and so you can read the whole thing. We've got some products out there to lay out the high points in it, but again, that gives us a decent amount of freedom to maneuver around the country and the local area and to return to portions of our normal lives. But I'd ask you to use caution. Right, this really is not the time to go hog wild out there. Right, go to restaurants, but protect yourself on your way in, protect yourself on your way out. Use the common sense that you've so effectively used in the past couple of months to keep COVID at a reasonable level. So I really do appreciate it, but this is not the time to say, hey, all the measures I've been doing I no longer need to do. And the disease is still out there. So we're going to continue to track the disease over the foreseeable future. We've watched other organizations, other areas around the Department of Defense have to snap back, right? So they went from Charlie to Bravo, and then they had a significant uptick in their surrounding communities around their installations, and they had to return to Charlie. So it's really let's all work together to ensure that we can continue to remain at Bravo Plus, and so we all have a critical role in doing that. And so again, General Order number 6, signed it this morning. It's effective immediately. You go out to dinner. You're probably already there. HPCon Bravo Plus, it'll be effective as we turn the clock from Friday to Saturday. It's effective immediately at 12:01 a.m. on Saturday morning. Again, appreciate the questions, appreciate your engagement, and again, appreciate you keeping us COVID free so we can execute the critically important mission that Fort Benning has, not only for the Army but for the nation. So thanks. One force, one fight. Thanks, Ben.
Sir, that's great. Sir, panel, thank you very much for addressing so many questions and concerns from our audience. To our Facebook audience, thank you for joining us this afternoon. We appreciate your participation and hope you found this discussion very informative. Although we answered many questions, I'm sure there are some questions that we did not get to during this forum. We will address these questions as quickly as possible. Please remember to protect yourself and others during this COVID-19 pandemic. Please continue to wash your hands thoroughly, practice good social distancing, and if you feel sick, stay home and seek medical attention. And continue to wear your mask to protect others and yourself. Thank you, and we look forward to you joining us for our next town hall. One force, one fight.